Hi everyone, I'm Whitney and I'm a dental hygienist. If there's one thing I've seen in my years of cleaning people's teeth, it's the emotional toll and embarrassment that comes with having bad breath. Even if you're not sure if you have bad breath or not, it can affect just about every day-to-day activity on your schedule. And unfortunately, bad breath is one of those things that even your family or close friends probably won't tell you about. That's just not something that we do. It can come off as rude. So either you go around without knowing about it, or you just feel paranoid every time you're standing too close to someone. And now, when you take regular, everyday battles with bad breath and throw in the COVID-19 pandemic on top of it, you have a recipe for an even stinkier problem: mask breath. Mask breath takes your everyday bad breath woes and puts them on steroids, especially since some people wind up breathing through their mouth whenever they're wearing a mask. It can dry out their oral tissues, and when your mouth is dry, stinky bacteria can reach elevated levels. So mouth breathing can actually make your breath worse. In addition, when you're wearing a mask, you're probably not drinking as much water as you should. The added dehydration, even if it's mild, on top of a dry mouth is the absolute worst, because we need water to naturally rinse and cleanse our mouth throughout the day. Then, on top of that, wearing a mask can make you feel less inclined to brush and floss your teeth. It's true. I mean, think about it. If you're going out to run errands or bumping into other people and you know you'll have a mask on, you may not worry about brushing as often or as long as you did pre-COVID. The mask is literally allowing us to be lazy with our dental hygiene. So, what are some ways to combat mask mouth and say goodbye to bad breath? Step 1, focus on breathing through your nose. Try not to breathe through your mouth. If your nose is stuffy, talk to your doctor about medication or other ways to clear up your nasal allergies. Your mouth should always be closed when you're breathing, unless of course you're exercising super hard or something like that, but in general, you always want to try to prioritize breathing through your nose. Step 2, increase your water intake. When your mouth is covered by a mask, drinking water can be extremely hard to keep up with. So set a timer and a goal. Make yourself go out of your way to drink a set amount of water at specific points throughout the day. Reminder alerts on your phone could be a total game changer. Step 3, get a tongue scraper. If you've never used a tongue scraper before, you're in for a surprise. They are amazing at what they do. The reason you want to clean your tongue every day is because it's estimated that 90% or more of the bacteria that cause bad breath are found on your tongue. That's a huge percentage. So use a tongue scraper to clean from back to front a few times. It can take a little practice if you have a sensitive gag reflex, but power through it. I promise it will change your life. And last but not least, step 4 is to revamp your brushing and flossing routine. Make sure you are using the proper technique to brush and floss. When I'm flossing my patients' teeth after a cleaning in the office, I have so many patients tell me, whoa, like that's not how I've been flossing. Should I be doing it how you just did it? And then I'm like, yes, and it's wild how many people don't floss correctly. I personally didn't even do it right until I got to dental hygiene school and I learned the proper C-shape hugging the tooth flossing motion. So if you're unsure if you're flossing correctly, the best person to ask is your dentist or your dental hygienist. Having said that, it is also important to make sure that you're up to date on your dental cleaning appointments. Now is the time to get your mask mouth bad breath under control, because before we know it, we'll be back in the land of mask-free living again. It has already started in a lot of areas, so don't let your dental hygiene get away from you. Again, I'm Whitney, and thanks for joining me today. Keep smiling, and I'll see you back next time.